half an hour, that access is being delayed when, on the one hand, you are cutting the money for access. That's what the Ryan Republican budget does. It cuts the money for access by reducing the residencies and reducing access to clinics by cutting by more than a third the money that is there to build up the clinics, the community clinics where people get care. In addition to that, I'm going to take a deep breath here, because I don't want to get wound up too tight about this issue. I want to ask my colleague from New York, Mr. Paul Tonko, to talk a little bit about the Medicare portion of this.
Absolutely. You know, we didn't hear anything about what would be lost in the process of their cuts or their repeal of the Affordable Care Act. And Representative Garamendi, you're absolutely right. There is much that has been gained by the American population, health consumers across this nation, with the efforts of Affordable Care Act to close the donut hole, to make prescription drugs more affordable for our pharmaceutical consumers out there, for seniors who require this medication, their prescription drugs, to stay well or to stay alive. Far too many were balancing their household budget by reducing their intake of prescriptions advised by their medical community. That is immoral, it's unnecessary, and has been addressed by the Affordable Care Act, so that 5.3 million seniors today are drawing $3.7 billion in benefits. That is something that could be taken away if the Republican majority in the House of Representatives had its way. Now, this is a wellness aspect. This is a part of a formula that allows people to be cured, to be healed, to be allowed to live in a quality of life that then addresses their very needs. And so I think it's necessary to point out what would be taken away from already the benefits offered, and there are more to come. But as we know, they're staged, they're rolled into the operations of reform over the next several years. But suffice it to say, the screenings, the annual checkup, flu shots that are made available without cost, no co-payment, no co-insurance, no deductible, is required here. These are huge benefits to every age demographic that are offered through the Affordable Care Act. And so we heard about adding to the cost curve of health care. We've heard about repealing the Affordable Care Act. We've heard about taking away the benefits that have just recently arrived at the doorsteps of health consumers across this great nation. And why would you want to play politics with the very fabric of quality of life of the people that we represent collectively by undoing progress? This is a recurring theme. You know, they want to undo Social Security that has a 76-year-old history. They want to voucher out Medicare that came to us in the mid-60s that addressed the economic stability, the predictability of senior households, and the quality of care, the quality of life in those households. Why would you want to take that progress away? It's heart-wrenching to listen to some of this insensitive, callous dialogue on the House floor that really renders the public that we're here to serve without benefits that have just recently arrived through the success of the Affordable Care Act. And Representative Garamendi, it is something that I think needs to be echoed out there from this House floor and then shared with the constituents of this great nation in a way that allows them to better understand what is part and parcel to the Affordable Care Act. A monumental piece of success. Is it perfect? No. We aimed for perfection. We struck with progress. But there is many a benefit that is part of the Affordable Care Act, and we're witnessing an attempt here, an all-out attempt by the Republican majority to turn that success into failure.
Well, let me pick up on that, Mr. Tonko, and you're quite correct. It's not just an attempt. There have been 33 votes on this floor by the Republican majority to either terminate completely or to eviscerate, in part, the Affordable Health Care Act. Now, what would be eviscerated? First of all, the Ryan Republican budget would terminate Medicare as we know it and give to every American who is not yet 55 years of age a coupon. It basically says this coupon is worth 70% of the cost of